We are doing lecture 4, which is anatomical terminology. These are all the words that from here on out we will be using to refer to the human body. We'll no longer say up, down, right, left. We will say superior, inferior, medial, lateral, etc. You have to start out right. This is one of the most important lectures that you'll have for the rest of the semester. Bones are named according to the words that we're using in this lecture. Muscles, okay, structures in your body are named according to the words in this lecture. So if you know what the words mean, a lot of times you don't even have to know where that structure is. If you can know its name or see its name, you can figure out where in the body it is. Again, if we look at the word anatomy, anatomy means to cut up or dissect, because that's how the very first human bodies were explored, by cutting them up, by dissecting them. Again, we always want to use from here on out the correct anatomical terminology and spelling. So if there are words in this lecture that give you a hard time, write everyone out 10 times, 20 times, until you write it out so many times the spelling sticks in your brain. We've already talked a little bit about this, but every once in a while you will see changes and discrepancies within especially anatomical terminology. Every 5 years, anatomists get together and they start to change the names of things. Okay? Like the adrenal gland that sits above your kidney. You will see it referred to as the suprarenal gland. Okay? Fibularis longus and fibularis brevis are muscles in the leg. They used to be called peroneus brevis and peroneus longus. So when you look at different pictures, different diagrams, your textbook, an online reference, talking to somebody else, sometimes you'll swear you're both talking about the same thing, but you're calling it by two different names. You might be right. So if you find a discrepancy, don't become discouraged and think it's not what you're looking for. Ask me. I'm aware of most of them, not all of them, but I can certainly help you figure it out. Okay, the first thing you have to learn about studying the human body is anatomical position. Every time you think about the human body, every time you're trying to figure out where a structure is, move the human body, anything, the human body should be in what's called anatomical position. And there are 5 requirements, okay? First thing is that the body must be erect. Now that doesn't mean standing, okay? I could be laying flat on the floor and still be in anatomical position. It means that I can't be slunched over or slouched over. The entire body has to be erect. The face has to be pointed forward. It cannot be pointed off to the sides. So the face points forward. This is the one that everybody forgets. Upper limbs are at your side, but the second part of this is what everybody neglects. Palms have to be facing forward. This is a very unnatural way to stand here. When I stand here naturally, my palms want to face towards the back. So I have to turn them in an unnatural and uncomfortable position right now for me to be in anatomical position. The lower limbs are parallel to each other. That means my 2 legs are parallel. Okay? Now they're not. Now they are. So they're parallel to each other. And my feet are pointed forward, because my legs could be parallel, but if I turn my toes out, okay, now I'm not in anatomical position. So body erect, face forward, upper limbs at your side, palms facing forward, lower limbs parallel, feet facing forward. Whenever you think about the human body, this is the picture that should come into your mind. This is anatomical position. Okay, putting the body in anatomical position, we can divide your entire body or a part of your body into different planes. And this is very important for imaging, for modeling. Okay, when we need to look at a structure, there aren't many structures we can see just on the outside of you. We would need to cut you open, look at a different view of you. And we use these planes, these 4 planes right here. Median, sagittal, frontal, horizontal. Just got taken over. Let's see. There we go. Median, sagittal, frontal, horizontal. Any view that you look at of the body, any model, any picture that you look at, will likely to be using one of these four planes. So the first one is median. Median divides the body or a structure into equal right and left halves. Okay? The key word is equal. There's just as much on the right side of the structure or of the body as there is on the left side of the structure. If we look at this picture, this dog is divided right in half. If we just wanted to look at his limb, we could divide the limb down the median plane. So while we usually refer it to the whole body, it can be just the structure. I could take a median section just of your skull. Okay? So the question becomes, how many median planes are there? How many spots on your body can I divide your entire body into an equal right and left half? There's just one. There's only one spot in your body where I can divide you into completely equal right and left halves. Because if I moved away from that spot, it would no longer be equal. Okay? If I cut you right down the middle, if I move a little bit to the right or a little bit to the left, it's not equal anymore. There's only one spot in your body where I can divide you equally. Now, the other thing to realize about your body, you are arranged around an invisible line that cuts through your median plane, that divides you in half. What do I mean by that? You have an eye on the right and an eye on the left. You have a nostril on the right, nostril on the left, ear on the right, ear on the left, kidney on the right, kidney on the left. Your body is a mirror image of itself from the right half to the left half. That's not true front to back. You don't have two eyes on the front, two eyes on the back. You don't have a nose on the front, nose on the back. You are arranged as a human being around the median plane. Sagittal plane is any plane that divides the body into unequal right and left halves. So we're still halves, or we're still right and left. Okay? If there's one median plane, how many places on your body can I divide you where you're unequal right and left? Infinite. There are infinite sagittal planes. Anywhere on your body that cuts you into right and left, besides right down the middle, is sagittal, and there are an infinite number of sagittal planes. Okay? The only one that's not sagittal is the median one, the one that divides you equally. So the key word between sagittal and median, equal or unequal. And we're still talking right and left halves. The frontal, which you will also see referred to as coronal. Coronal is the old, frontal is the new. Coronal will come up again in bones, okay, because they haven't changed some of the coronal structures yet to say frontal. So that's why I have coronal there in parentheses, so you remember frontal and coronal are interchangeable. So a frontal section is a vertical plane dividing the body into a front and a back. And we'll see that now we're going to refer to the front of you as the anterior, and we're going to refer to the back of you as posterior. Is this an equal division of the body? No, because you are not arranged around a frontal plane. If I divide you into a front and a back, there are things on the front of you that are not on the back of you. So that is not an equal division. And we don't say that it's equal. It doesn't say equal anywhere in here. Okay? It just says coronal. How many coronal planes are there? Or frontal? Infinite. There's an infinite number of coronal or frontal planes. Anywhere I divide you that gives me an anterior and a posterior and a front and a back, it qualifies as frontal, okay, or coronal. It doesn't matter if it's 50-50, 60-40, it doesn't matter. If you have a front half and a back half, it's coronal or frontal. The last one is horizontal. And a horizontal has by far the most names. It can be called a transverse section, a transaxial section, or you will frequently see it referred to as a cross section. This is a division of the body or of a structure that divides it into a top and a bottom, or now we'll see a superior and an inferior. there are how many transverse planes? Infinite. There's an infinite number of horizontal or transverse planes. This blue sheet here is chopping this woman in half. I could move it anywhere from her toes to the top of her head. These would all be horizontal planes. This is how many imaging tools work. They take slices of the human body and you look at those slice pictures. And sometimes they have computers now that will put those pictures together to generate entire organs. Because there are so many horizontal planes, and this is an imaging technique we use a lot, you usually have a reference point. Okay? This woman is being divided in her transumbilical plane. If I go trans-America, where am I going? I'm going across America. Okay? So transumbilical means it's crossing her. What's your umbilicus? Your belly button. It's crossing her right in her belly button. Okay? A lot of times they'll reference the vertebrae in your back. They'll say this is an image from the level of L1, which is in your lower back, of C1, which is up in your neck. So there usually will be a reference point for this horizontal plane. Again, why is it important to know the planes? Not only is it a frequently used technique for imaging like X-rays, CAT scans, and MRIs, but also as we progress through and we start to look at bones and we start to look at models and organs, the first thing you should do whenever you're looking at a model or a picture is you should say to yourself, this is the view that I'm looking at. I'm looking at a median view. I'm looking at a horizontal view. I am looking at a coronal, a frontal, okay? You should first identify the view that you're looking at. That way you can orient yourself and have an idea where some of the main structures should fall. Okay, even before we can start to get to the words, we have to rename your body. A lot of people mislabel their own body. Okay? Your body can be divided into what's called an axial region, which includes your head, neck, and the trunk of your body. And the trunk of your body is your thorax. That's where your lungs and heart are. Your abdomen, where most of your organs are. And your pelvis, okay, where your bladder and reproductive organs are. That's the axial region. Okay? You can think of that as the central region of your body. So we don't say chest anymore, we say thorax. We don't say belly anymore, we say abdomen. Okay? So the axial region, head, neck, and trunk. And what sticks off of the axial region are the appendicular regions. An appendage, or appendicular, is something that comes off the main part. So the axial region is the main part, the central part. And then we have things that stick off of it. We have upper limbs and lower limbs. So this is not your arm anymore. When you refer to this entire structure now, this is your upper limb. From your shoulder to your elbow, that is your arm. So if you say arm to me now, I will assume you are referring to the specific region of your upper limb that occurs from your shoulder to your elbow. From your elbow to your wrist is your forearm. And of course, from your wrist forward is your hand. So your upper limb has three regions: arm, forearm, hand. And the entire appendage is called your upper limb. Your lower limb, so this isn't your leg anymore. Okay? If you tell me your leg, I will assume you are referring to the specific region from your knee to your ankle. That's your leg. From your knee to your thigh, okay, up to your hip, that's your thigh. Sorry, from your knee to your hip is your thigh. So let's go down the other way. Hip to knee is your thigh. Knee to ankle, and then in front of your ankle, that's your foot. 3 regions to the upper limb, 3 regions to the lower limb. That is the beginning of realizing that your upper limb and your lower limb are mirrors of each other, except for your lower limb is larger. you will find repeated similarities between the upper and lower limb, okay? And that's not a coincidence. Your lower limb is larger, and when we get to bones, we'll talk about why it's larger, okay? That's an example of taking a step back and realizing the bigger picture, okay? Sure, I can remember all the regions to the upper limb and lower limb, but I have to take a step back and say, wait a minute, there's 3 in each. And when you look at bones, you'll see that there's 1 bone in the region closest to the axial part, and there's 2 bones in the region farthest. 1 bone in the thigh, 2 bones in the leg. 1 bone in the arm, 2 bones in the forearm. They are set up like mirrors of each other, just that your lower limb is larger. How do we attach these appendages to the axial region, to the head, neck, and trunk? We have what are called appendicular girdles. Girdles hold things together. In this case, they hold the axial region to the appendicular region. Your upper limb is held onto your body by the pectoral girdle, okay? And the bones that help hold the upper limb on are the clavicle, which is better known as your collarbone, and the scapula, which is better known as your shoulder blade. So we have an attachment on the front and we have an attachment on the back that help to hold the upper limb onto the body. Now that's not the only thing. There are muscles, tendons, ligaments, all also helping to hold it on. But if we're talking just bones, you have an attachment in the front, attachment in the back. If we look at your lower limb is attached to the axial region by the pelvic girdle. And that consists of your pelvis, okay, your pelvic bones, your hip bones on the front, and a triangular bone called your sacrum, and that's on the back. So just like there's a front and back attachment for the upper limb, front and back attachment for the lower limb. And again, it's not the only thing. Muscles, tendons, ligaments, all helping to hold the limb onto the axial region. More regions, okay? Abdominal regions. You can divide the abdomen into either 4 or 9 regions. We'll start with the 4. Where is the middle of these 4 regions? What is that right there? What would be there if the skin was on? Belly button, okay? We divide you right through your belly button. Right upper, left upper. Right lower, left lower, okay? Quad means 4. These are quadrants. So LUQ, left upper quadrant. RUQ, right upper quadrant. Why is this important? Okay, especially if you're going into the healthcare field. Plenty of people come in and say, it hurts right here. Okay? You can't put it hurts right here on the chart. Okay? You have to put something more specific so the next person who looks at the chart knows where the pain is. So you would put patient complains of pain in RUQ, right upper quadrant. Okay? So the next person who looked would say, oh, you must be experiencing pain up here. Okay? RUQ, LUQ, RLQ, right lower quadrant, LLQ, left lower quadrant. The other thing I want you to make a mental note on, based on this slide, because it will be a question on the exam, are the major organs and what quadrants they appear in. Okay? The majority of your liver and gallbladder are in the right upper quadrant. Your stomach and spleen are in the left upper quadrant. Okay? In the left lower quadrant, you have a good bit of the intestines. Okay? In females, you'll also find the ovary in the left lower quadrant, the left ovary. The right lower quadrant, okay, has the appendix. It also has a good bit of intestine, and again, in females, you'll find the right ovary. That's the simplest way to divide the abdomen. Okay? A more specific way to divide the abdomen is into 9 regions. Okay? Which region has the belly button in it? The umbilical region, the one right in the center. Okay? So that's where this was divided. That's the belly button. Okay? We'll start above that. Epigastric. What is gastric? What does that refer to? Stomach, digestive. Okay, that's gastric. Epi, okay, is above or upon or around. Okay, that's epi, so it refers to the stomach. Right and left hypochondriac region. What's a hypochondriac? Somebody who thinks they're always sick. I have no idea how they use the word hypochondriac to denote somebody who thinks they're always sick, because the word hypochondriac breaks down into something we've already talked about. Hypo, as in hypoxic, means what?
Without.
Not without.
Low.
Low. Hypo means low, or it can also mean below, okay, like underneath. Chondra. What was a chondrocyte in histology? Or perichondrium? What did those have to do with?
Build and maintain something.
The something is the word I want.
Metabolism?
It's not bones. It is a tissue, but I need the specific chondra. It is cartilage. Chondra means cartilage. So hypochondriac, that word actually means below the cartilage, which in this setting makes perfect sense. Your ribs have a great deal of cartilage in them. That's what allows you to expand and contract your chest cavity every time you breathe. Bone is not flexible, so if all of your ribs were bone, you wouldn't be able to expand and contract your chest cavity very well. But a great deal of your chest cavity, of your ribs is cartilage. So the left hypochondriac region is right under your rib cage on the left side, and that makes perfect sense according to that word. So why it means somebody who's always sick, I don't know. Okay, so you have your right and left hypochondriac regions. That's right up under the ribs. We have your umbilical, and then we have your right and left lumbar regions. Lumbar refers to the vertebrae, okay, and we'll talk about that in the skeletal system, but your lumbar region is in your lower back. Okay, so if you think about where your lower back is, this is your right and left lumbar region. Hypogastric. You guys should definitely be able to tell me what that word means. Below digestion or below the stomach, because yes, we're way below the stomach, but don't forget intestines are also responsible for digestion. The bladder is in the hypogastric region. We're down in the pelvis now. Right and left iliac region. That hip bone that sticks out on the front of you, that's called your iliac bone, okay? So right and left iliac regions are the organs that are right there. And most notably, you have the ovaries in females. Those are in your right and left iliac region. You might even hit the ureters coming down, attaching to the bladder, okay? So again, that's more specific. If a doctor came in and he wanted to know where the pain was, sure, you could narrow it down to right upper quadrant, but it would be more specific if you could say it's higher up, it's right hypochondriac, or it's a little bit lower down, it's right lumbar. The last thing I want to point out that's very important on these slides, as you guys are looking at these slides, what side of your body is this? What side of your body is facing this picture? When I'm facing this picture, this is my right side, but it says left here. This is my left side, but it says right here. Do not forget that you are looking at the mirror image of your body. And so when I put these pictures on your exam and ask you to label the areas, don't assume because your right side is here that this is right upper and right lower. You have to flip yourself around and face out. Now it makes sense that this is left and this is right. But when I'm looking at it, it's backwards. Okay? And that is an incredibly common mistake. So remember to orient yourself to the body that you're looking at. Don't name it off your body. Name it off the one you're looking at. Other body cavities. We just spent a lot of time on the abdominal cavity, but you have other cavities. Oral and digestive. Your oral cavity is better known as your mouth. Okay? That's your oral cavity. The digestive cavity is your digestive tract. It's one long tube from beginning to end. Your esophagus, your stomach, large intestine, small intestine, colon, rectum, anus. Okay? It's all one long tube. Okay? It's barely divided into different sections. Your nasal cavity is an opening right behind your nostrils. Your orbital cavity, what is orbital on you? Eyes. That's where your eyes, if we take your eyes out, there's a big cavity within your skull that accommodates your eye. That's the orbital cavity. Your middle ear is a cavity, okay, an air-filled cavity. And we could even name synovial cavities. Those are fluid-filled cavities associated with different joints in your body. So you are full of cavities. Even though we focused a lot of our effort into the abdomen, okay, you have, and they're not even all on this slide. Okay, you have a lot of other cavities in your body. Speaking of cavities, question?
Sorry.
That's all right.
Just for like future references and stuff, like on the exam, do you need to know like what all these are? Like do you need to know like the synovial is fluid field associated with the joints, or do you just want us to know like?
If it comes out of my mouth during lecture, you should know it.
Okay.
That's a good. If I don't address it, don't worry about it. And you will also be provided a study guide for the exam.
Oh, okay.
Yeah. So membranes and cavities have a unique relationship. So your body cavities that contain organs. So this is not necessarily true in your nasal cavity because there are no organs in there. But it is true of your abdominal cavity, of your thoracic cavity. They have what are called serous membranes. Serous membranes come in sets of two. Okay? So you have a parietal serous membrane and a visceral serous membrane. Okay? So the word serous membrane should never mean one thing to you. It should mean there's a set of two membranes. The parietal serous membrane lines the cavity itself. So if we're talking about your abdomen, the parietal serous membrane lines the other side of your abdominal muscles, essentially. Okay? The visceral serous membrane covers the organ itself. So your stomach, your intestines, your spleen, your liver, they are all covered with a visceral serous membrane. What this does is it allows these two structures, the cavity and the organ, to just slide past one another. They don't get hung up on one another. They don't get tangled. Also between those two membranes is going to be a fluid that acts like lubrication. This is why if I stand up and I squish over to one side, all my organs just go over here. And if I squish over here, they just all go over here. They're not getting caught. They're not getting tangled. I don't have to worry about tying my own intestines up in knots. If you've ever been able to watch an abdominal surgery, okay, when they cut into the abdomen, maybe there's something behind the small intestine they need to get to. They just pull the small intestine out, lay it on the surgical sheet, do what they need to do, and then they just stuff it back in. Okay? They don't need to lay it out in those perfect lines that you see in the models. They just stuff it back in there because of the membranes. The intestine will just slip and slide past itself and go right back into place. Okay? They don't need to worry about arranging it. It won't get caught in knots. It won't tie up. It won't block. Okay? Because of this parietal and visceral serous membrane. The same thing applies to your lungs. There is a visceral serous membrane on your lungs. There's a parietal serous membrane on the inside of your chest cavity. Every time your lungs expand and contract, they can slide past the chest wall. A very similar, although differently named set of membranes, if you think about your eye. Okay? What if you felt friction and rubbing every time you blinked? Okay, that would be horrible. But the reason you don't is because there's a membrane on your eyeball and there's a membrane on the inside of your eyelid. And there's liquid in between them that allows them to slide past one another all day long. Okay? If you don't want any friction between your eyeball and your eyelid, you certainly don't want it between your heart and your chest wall, between your lungs and your chest wall, between your organs and your abdominal wall. Anywhere there's movement in your body, you have this setup. And here's a picture. So here's abstractly, if your fist was your heart and you pushed it into an air-filled balloon, part of that balloon wraps itself around your hand. Okay? And then there's a space, and then the rest of the balloon. So the part of the balloon clinging to your hand is the visceral membrane. Then you have the space, And then you have the other part of the balloon itself, and that's the parietal. So visceral, space, parietal. Real example is your heart. It beats within what's called the pericardial sac. The heart itself has a visceral pericardium, that's the visceral serous membrane, and then the pericardial sac has its own parietal pericardium or parietal serous membrane. So again, anywhere there's constant movement in your body, you have this setup to keep any friction from happening. Okay? It lets your heart beat in a frictionless environment. And I was going to say something else on this slide. It's gone. I can't remember what it was. All right. Now we get to start with the words. I highly recommend flashcards for these words. Okay? Name of the flashcard, or name, oh my gosh, the word on one side, what it means on the other, and carry them with you everywhere you go. All right, we're going to start with directional terms. This means the body is still, and I'm just trying to move from one point to the other on a completely still body. Always want to start in anatomical position, and I will try to get you on the exam. Okay? I will ask you questions where if you don't have your body in anatomical position, you're going to get the question wrong, and I'll give you those examples as we get into the terms. Again, body is not moving. We will have movement terms after we're done with directional terms, but just so you know, body is completely still. Superior and inferior. We've already talked about this when we were talking about planes. Superior means more towards the top of your head. Inferior means more towards your feet. Okay? An example. My head is superior to my thorax. And there's two ways to say everything. My thorax is inferior to my head. Okay? Now you tell me, your abdomen is what to your pelvis? Superior. Abdomen is above your pelvis. Your pelvis is what to your abdomen? Okay. Your heart is what to your stomach? Superior. Your stomach is to your heart. Okay. That's superior and inferior. It's what you used to say above or below or up or down, but we don't say that anymore. Now we say superior and inferior. Anterior and posterior, and you'll have to forgive me because I don't have 3 dimensions. That anterior arrow is supposed to be coming out at you, and the posterior arrow is supposed to be going back away from you. Anterior is the front of your body. Posterior is the back of your body. So, example, my eyes are anterior to the back of my head. Okay? The back of my head is to my eyes. Okay? You can also sometimes use it by itself. Like your kidneys are a posterior structure. Your kidneys are all the way in the back. Okay? They're not sitting up here on the anterior, they're sitting all the way in the back. Okay? Your sternum, which is the bone that covers your heart, is what to your spine? It's anterior. Your sternum, which is right here, is anterior. Oops, I'm touching my microphone. To your spine. Okay? Anterior is front of the body, posterior back of the body. These used to be dorsal and ventral. Okay? So when you see things named dorsal and ventral, that's the old anterior and posterior. Dorsal is posterior, ventral is anterior. Lateral and medial. Okay? Remember that your body is divided invisibly by a line right down the middle. That's your median plane. Just because you're not physically cut in half, oh my goodness. We're going to have to find a way to remedy this. Okay, just because you're not physically cut in half doesn't mean you can't reference that invisible line. Okay? Lateral and medial. Medial means a structure is closer to that median plane. Lateral means a structure is farther away from that median plane or middle of your body. Okay, here we go. My ear is what to my nose? My ear is lateral to my nose. So my nose must be what to my ear? Good. My shoulder is what to my sternum? My shoulder is lateral to my sternum. My shoulder is farther away from the middle of my body than my sternum. My pinky is what to my thumb? This is how I'll get you on your exam. You got to be in anatomical position. Now my pinky is medial to my thumb. My pinky is closer to the center of my body than my thumb is. My thumb is what to my pinky? Lateral. My thumb is farther from the center of my body than my pinky. Okay? That's how you have to be on the test, thinking, all right, if I'm in anatomical position, that's the first thing you should think of. Oops, there goes my wedding band. Then you should get it. Thank you. Okay. Proximal and distal. These two can present a little bit of a problem, but here's how you clear it up. You would normally want to use superior and inferior. But there's a part of your body you can't use superior and inferior on, and that's the limbs, okay? Because even though we're not supposed to move, your limbs are movable, okay? I can move my limbs around. So we don't want to use superior and inferior in the limbs. I don't want you to think your hand is inferior to your elbow. Whenever you are in the upper limb or the lower limb, always use proximal and distal. Okay, so that's how you should know when to use them. If on the test you are considering using the words proximal and distal to answer a question, you had first better be sure you are in either the upper or lower limb. Otherwise, you'd want to use superior and inferior. Okay? Proximal means closer to the trunk of the body, following the limb. Okay? Proximal means I'm closer to the trunk of the body. Distal means I am farther from the trunk of the body. That way, let's say I am in anatomical position, I could use superior and inferior. I could say my elbow is superior to my hand. Well, what about now? It doesn't work anymore because I moved the limb. But I can always use proximal and distal. My hand is distal to my elbow, and that works no matter how I move my limb. My elbow will always have the same relationship with the trunk of my body, okay? It won't matter if I move it. So proximal means closer to the trunk of the body. Distal means farther from the trunk of the body. So your knee is what to your hip? Distal. My knee is distal to my hip. My knee is farther from the trunk of my body, okay? My knee is what to my ankle? Proximal. My knee is proximal to my ankle. My knee is closer to the trunk of my body than my ankle. So again, only use them when you are in the upper and lower limbs. Superficial, and the opposite of this will be on the next slide. It's deep. Superficial is similar to superior, okay? That's why they both start with super, okay? But when we use superficial, it's a finer description. We're talking layers, okay? We're talking a smaller movement. Superior and inferior, we're talking jumps on the body, organs, structures. Superficial, we're talking just individual layers. Like your skin is superficial to your muscle, to your skeletal muscle, okay? Your scalp is superficial to your skull, okay? It's a much more delicate designation. Deep is the opposite. When things are underneath each other, they're deep to each other. So your skeletal muscles are deep to your skin. Your skull is deep to your scalp. Okay, we're just using individual layers. Okay, is it superior? Yeah, it is technically on top of it or above it, but it's it's a more delicate designation. Dorsum. Now the dorsum on your body is two areas. You have a dorsum of the hand and a dorsum of the foot. So if you use the word dorsum, you better designate which dorsum you're talking about. The dorsum of your hand is this part of your hand. So now you tell me, is that the anterior or posterior surface of your hand? That's the posterior surface of your hand because you got to be in anatomical position, and it's facing the back. So the dorsum of your hand is the posterior. It's the back of your hand. The dorsum of your foot is the top of your foot. It's the superior portion of your foot, or you could also say superficial. Okay? That's the dorsum of the foot. The other sides, palmar and plantar. Palmar surface of your hand is which surface of your hand? Anterior or posterior? Anterior, because we're in anatomical position. Okay? Palmar surface of your hand is the anterior. The dorsum of your hand is the posterior. The plantar surface of the foot is the sole of the foot, the bottom of the foot. Okay? This is why we call them plantar warts, because they are on the plantar surface of the foot. Sides of the body. Okay? There are some structures that appear on one side of your body or two sides of your body. Sometimes we have to describe organs in relationship to each other, and these are the words that help us do that. Bilateral. Okay? Bi means, and anybody want to take a generic guess at lateral? It just means side. Okay? You're to the side. If you're not in the middle, you're on the side. That's why if it's away from the median plane, it's lateral. Okay? You're on a side. If it's bilateral, that is generally used to describe the same organ on both sides of the body. So what's a bilateral organ or structure on you? Kidneys, ovaries, lungs, eyes, ears. You are full of bilateral structures because you are arranged around that median plane. For the most part, your right side is a mirror of your left side. Okay? Those are bilateral. Something, a structure, an organ is both on the right and left side. Unilateral means only occurring on one side of the body. What is a unilateral organ? Spleen is a good one. Liver and heart are tricky because the majority of them is on one side, but they're not completely on one side. So spleen is a good one. Gallbladder is a good one. What's something you can have removed? No, not your pancreas. Appendix. Appendix. Your gallbladder, your spleen, your appendix, those are all really good unilateral examples. Ipsilateral means found on the same side of the body. And when you use ipsilateral, you're usually referring to two different structures, like your right hand and your right foot are ipsilateral. Okay? They're both on the same side of the body. Contralateral is structures occurring on opposite sides of the body. And we're usually talking about two different structures. Your right hand and your left foot are contralateral. A lot of times you use contralateral to describe a movement, say, in surgery. Okay? And then we went contralaterally. That means we went we were at the kidney, we went contralaterally to the spleen. That means you moved across the body to a different structure. So it's structures appearing on opposite sides of the body. So the difference between contralateral and bilateral is that bilateral usually refers to the same structure on both sides. Contralateral is usually different structures on different sides. Okay, now we're going to move the body. So up until now, our body has been completely still and for the most part in anatomical position. Now we're going to start describing movements of the body. Again, movement has to occur at a joint, but all joints do not have to move. Because what is the definition of a joint? Where two bones meet. That's the only thing that defines a joint. Sometimes there's movement, sometimes there's not. So, movement of the body has to occur at a joint, but not all joints have to actually move. Okay? When there is movement at a joint, we will generally see, sorry, it's an instructor. I want to make sure they're coming into campus. Oh, I lost it. Okay, I'll get to it in a minute. Thank you. Sorry about the interruption. So when a joint does have movement, a tendon or a muscle will cross over it. So you'll have two bones meeting and then something will cross over it. And that's a principle of physics. If you want to have movement between two pieces, something has to cross over. That's true in a car. That's true in your body. Okay? So we'll start flexion and extension. I'll get my workout today. Okay, little bit of geometry. How many degrees are in a straight line? 180. Very good. 180 degrees in a straight line. How many degrees are in a right triangle? Very good. 90. This is the difference between flexion and extension. For the most part, you can think of your erect body as being 180 degrees. If you take any part of your body and decrease from 180, that's flexing. So I'm at 180. Now my upper limb is at 90. That's flexing. Okay, my leg, my lower limb is at 180. Now it's at 90. That's flexing. My entire body is at 180. Now it's at 90. Okay, head, neck, 180, 90. If I decrease the angle, if I'm going down towards 0, I'm flexing. Extending is the opposite. Extension increases the angle. If I start at 90 and I go back to 180, now I'm extending. Flexing, extending, flexing, extending, flexing, extending, flexing, extending. And I tell you this now, and it is the best way to learn it. Is just stand around and do it and say it at the same time. And you'll look like a big doofus, but you know what? You'll get it right on the test. So next time you're waiting to get into a classroom and you're just standing out in the hall, you should be standing there going flex, extend, flex, extend, flex, extend. Okay? And there's lots more. Dorsiflexion and plantar flexion. This has to do with movement of the foot. If you dorsiflex, okay, you're decreasing the angle from the dorsum of your foot. Decreases the angle between the foot and the leg. When you dorsiflex, you point your toes up to the sky. I'm just going to hold on to the board since I'm wearing heels today. Okay, dorsiflexing and then plantar flexing is standing on your toes. Okay, dorsiflexing, plantar flexing. Ballerina, way up on her tiptoes, extreme plantar flexion. Okay. So if your toes are pointing up to the sky, you're dorsiflexing. If you're standing on the tips of your toes, you're plantar flexing. Okay? Abduction and adduction. They only vary by one letter. Okay? It's either AB or AD. So on the test, make sure you spell it right, because you don't have any wiggle room with these two words. If you abduct something, you move it away from the median plane. Where's the median plane? Right in the middle of your body. This is abducting. This is abducting. When you move it back, that's adducting. Abduction, adduction. Abduction, adduction. Okay? Again, stand in the hall. Flex, extend. Dorsiflex, plantar flex. Abduct, adduct. Okay? The other useful thing, I don't want you to just think you're going to get tested on this and it's never going to come back to haunt you, because it is. Muscles in your body start with the word abductor or adductor. Abductor longus, adductor brevis, adductor magnus. Okay? If you think about abductor muscles, which side should they appear on? If it's going to move my leg this way, should it be on the inside of my leg or the outside? Should be on the outside, okay? So anything abductor, okay, but if it's adductor and it's going to move my leg back, where should it be? Inside. Thus, when we get to muscles, you'll see adductors are all on the inside of your thigh. pronate and supinate. This has to do with moving your palm and your forearm. And the way that I always remember this is the 3 P's. Pronating means your palms are posterior. Okay? So when my palms are facing the posterior, I'm pronated. Okay? Pronate, palms posterior. Supinate, palms to the anterior. Pronate, supinate. Pronate, supinate. So in anatomical position, are you pronated or supinated? You're supinated because your palms are to the anterior. So pronate, supinate. Pronate, supinate. Abduct, adduct. Flex, extend. Dorsiflex, plantarflex. Okay? There it is. Eversion and inversion. Okay? This has to do with the way that you bear weight on the bottom of your foot. Okay? If you evert, that means you elevate the lateral or outside edge of your foot, and you bear weight on the inside edge of your foot. So if you are a runner or you ever go into a running store, okay, they're going to take off your shoe and they're going to look at the tread on the bottom, and they're going to see how it wears. If most of the tread is worn off the inside of your shoe, that means you're an everter. That means you elevate the lateral edge of your foot and you bear the weight on the inside. If most of the tread is worn on the outside of your shoe, that means you're an inverter. You pick up the inside of your foot and you walk more on the outside of your foot. Okay, so eversion and inversion. We also use these words to describe ankle sprains because everybody has been walking along and slipped off the side of their ankle. You either evert or you invert. If you evert, which ankle should be injured? Okay? If I have the elevation on the lateral edge and I bear the weight on the inside edge, which ankle am I hurting? I'm putting the strain on the inside ankle. Okay? If you evert, the inside ankle should be injured. If you invert, which ankle is hurt? The outside. All the weight is coming down with the force on the outside ankle. So you will use the words evert or invert to describe ankle sprains because that lets somebody know which ankle is injured. Circumduction. Okay? This is 360-degree movement. It's only available in a few places in your body where you have what's called a ball and socket joint, shoulder, hip. Okay? This is circumduction. This is circumduction. Okay? 360-degree movement. Rotation. Okay? You can have medial rotation or lateral rotation. Rotation itself is movement of the body around its long axis. Your long axis is another word for median plane. If you have medial rotation, we're usually talking about the limbs when we talk about rotation. The anterior surface of the limb is rotated towards the midline. So if my lower limbs are medially rotated, okay, my toes are pointing towards each other. They're pointing towards the median line. If I'm laterally rotated, I'm a ballerina. Okay, my feet are turned out, away from the median line, or median plane, or long axis. All the same, all mean the same. So medial rotation, lateral rotation. The anterior surface of the limb is either pointing towards your long axis or away from your long axis. Elevation and depression. Moves a part of the body superiorly if it's elevation. Moves a part of the body inferiorly if it's depression. If we're talking about your jaw, if your mouth is closed, you've elevated your jaw. If your mouth is open, you've depressed your jaw. Okay? So, what is this movement? This is abduction. This is abduction. This is adduction. Now what's this? No, this is not the Nazi salute. Is my upper limb changing its relationship with the median plane of my body? Is it moving closer or farther when I do this? So we have to come up with a different name for this movement. I'm elevating, and now I'm depressing. So this is abduction, but this is elevation, okay? This is why we have all these different terms. It would be easy if we could just move everything up, but you're also constantly referencing that median plane. So again, abduction, elevation, okay, or even elevation. Last one, opposition. When people say that human beings have opposable thumbs, this is what separates us. It's because we can touch our fingertips to our thumb. Okay? Some higher primates can do this, but if you start to look, next time you go to the zoo, look at the hands of the primates. A lot of them look like their thumb is fixed in a position. It's not opposable. They cannot take it and touch it to the tips of their fingers. So while this seems boring and yeah, we can all do it, okay, it's a very important distinguishing feature of higher primates is having that opposable thumb, one that can move and touch your fingertips. Okay, get those in your head. Okay, note cards, flashcards, learn them.